Here's the biggest mistake I see. People Google everything. The number one thing is that they Google it in isolation. Labs are meant to be read like a story, not a single word. Understanding your lab results without freaking out. So you just got your lab results back. You see red numbers, arrows up and down. Things are high, low. Your brain goes straight to panic. Am I sick? Do I have something serious? Here's the truth. Most lab results aren't black and white. They're tools, not verdicts. Relax. I'll explain how to read them without freaking out. So what do they really mean? First things first, normal ranges aren't always perfect. They're averages based on large populations. So if you're a little above or below, it doesn't always mean something's wrong. For example, a fasting blood sugar of 102, it's gonna flag as high, but one reading doesn't diagnose you with diabetes. Same with cholesterol, context matters. That's why we always repeat labs. Look at your history before labeling it as a disease or an actual illness. Let's take 3 labs that people usually panic over. Cholesterol, of course. LDL is your lousy cholesterol. That's the one that can increase your risk for heart disease. So that one we do check. HDL is healthy cholesterol, so it's protective. But one high LDL doesn't mean you're gonna have a heart attack tomorrow. Blood sugar, of course, fasting blood sugar can be affected by so many different factors like sleep, stress, even what you might have eaten last night. And then of course, kidney tests like creatine, GFR, which is your filtration rate. It helps check your kidney function. But let's say you're dehydrated, that could actually decrease your kidney function, which then can go back up if you drink some more water. Here's the biggest mistake I see. People Google everything. The number one thing is that they Google it in isolation. Labs are meant to be read like a story, not a single word. Your doctor combines these results with your symptoms, history, medications, even family background. That's why the same lab value might be okay for you, but concerning for someone else. Of course, sometimes labs do mean something urgent. So here's when you don't want to wait. If you have high blood sugar with symptoms like thirst, urination, blurry vision, that's definitely something to look out for. Very low hemoglobin, you feel faint, you feel dizzy, lightheaded, that could be a sign of anemia. Your liver or kidney numbers are way outside your range. You definitely want to listen to your doctor or follow up with them to see what they want to do. All in all, your labs are like a snapshot, not a life sentence. They're your guides. They help guide decisions, they don't define you. Next time you see those red arrows, don't panic. Ask, what's the pattern, what's the context, and what's my next step? A lot of times when it comes to labs, I get a lot of patients asking me, what does this mean? It's never been up. Why is it low? Why did it change? So I say, the whole point is we check your labs on a routine basis so we get more data points and we can see trends. Somebody once told me, trends are your friends. So instead of basing all of our decisions on one set of labs, if I have a year, 2, 3 years worth of your labs, I can make a better decision which way to go. Now, another thing, a lot of my patients try to get good lab results or try to score well, try to get good grades on their labs, so they may actually eat healthy or stop drinking alcohol for the week before they come see me. But the truth is, I tell them, look, your labs are great, but don't trick yourself. Hopefully make the lifestyle decisions and the differences for your own health versus just to chase the number. Although labs are extremely important, they help guide decisions significantly. I always tell my patients, I don't treat numbers, I treat my patient. Certain things, of course, we do have to check numbers, and with labs, there's so many different things we can really narrow down. For me, from patients, if they have questions, I always say, ask me, call me. I have no problem with patients Googling things, but just Google responsibly. A lot of people now use ChatGPT to update and upload all of their labs, which is totally fine. But I would say you use these Google AI tools as a supplement along with seeing your doctor. Those two together hopefully will give you a better understanding of your health. Regardless though, if you don't get your labs routinely checked, you should definitely follow up with your doctor in the next week to 2 weeks just to see. It's just a good idea to see what is your baseline. especially because from there we have a great comparison. And I always tell my patients, make sure you keep a copy of your labs. Maybe you keep a folder, maybe you keep it in a digital file, but it's so important to have it. Because at the end of the day, as doctors, we keep a lot of your records, but if you go somewhere, God forbid, you have to see a doctor, it's always good to have your files on hand. But overall, labs are a routine and a very vital part of my job, and I enjoy explaining and teaching people and my patients what it means. And for us, as we learn more about medicine, we just keep learning about more lab tests that can be done for all different diseases and all different concerns. Hopefully at some point they'll find better ways of getting labs without taking as much blood and maybe more advanced technology. But so far, I'm a big believer in getting labs checked and being routine with your doctor, routine with your work, but most importantly, routine with your life and your healthy habits. And in terms of labs, a few things you just want to make sure is how to prepare. When I'd say fast, that does not mean no water or no coffee. Fasting means no food, but usually we want a minimum of 10 hours of a water fast. Definitely drink water, stay hydrated, because that actually helps with us getting your blood, getting your veins. You can drink black coffee, green tea, or black tea, but no sugar, creamer added to that. For those who sometimes get nervous, I have patients who either bring headphones, music. Some people actually can use lidocaine cream to rub over the vein. That way it can numb it. So it might give you less irritation and maybe less painful with the procedure. But usually it's pretty fast. Labs don't take that long. It's quick. You're usually in and out. And for labs to come back, you're looking at it maybe 1 to 3 days is our turnaround. Of course, it may take longer based on where you're at or what labs are drawn. If it's the standard labs, for example, what they call the complete metabolic panel, complete blood cell count, CBC, the CMP, the A1C, which is for diabetes. Then you have the lipid panel, which is for cholesterol, vitamin D, TSH, free T4 for thyroid. For men, we check the PSA, which is for the prostate. Usually we check the urine, and we also check for our physicals, microalbuminuria. And so that's for the protein. And in general, these labs are pretty standard, but if a patient comes in with different symptoms, things we have to work up, then of course we'll do more detailed lab testing. Of course, I get a lot of requests from patients to want to order all these different tests. I'm not opposed to it. Like a lot of patients say, hey, I want to order 20 different blood tests. Or they say, hey, I went to my naturopathic doctor, my chiropractic, my homeopath. I went to all my doctors and they said, I want your doctor to draw these labs. So I tell my patients the same thing. Look, I have no problem. You can draw your labs, no problem, but then what? What are we gonna do with all this information? What is gonna change? What will this data do for your outcomes and what you're planning to change based on that? So I always gotta play both sides. I have no problem. Some people is good to know, but at the same time, at the end of the day, a lot of things in medicine don't really change and they are centralized around few pillars. That includes your diet, exercise, sleep, and stress. That's why I feel labs are a good supplement to just talking, physical exam, the regular routine follow-up that I see patients for. Because I think even more than labs, it's a good idea to come in to see your doctor routinely, because you can talk about how your lifestyle has been. Are you not only routine on your medications? Are you routine on your labs? Are you routine on your habits and your healthy living and your habits in general? So with those things, it's so easy to change. There's a lot of different ways to figure it out. I'm a big believer in small steps. Build it slowly. It's very doable and it can make a big difference in your life and just how you feel.